Hey guys, hope you all are doing super well. Today I'm going to discuss a topic that most of the PharmD students must have contemplated about before taking admission into PharmD. And this video is going to be super useful if you're currently in your 12th standard or you have just passed your 12th and are looking forward to having a career in the medical field. So, guys, in today's video, I'll be covering the basic differences between PharmD and MBBS. What are the similarities between these two fields? And trust me, there are many. And finally, the golden question that we all have been looking and answered to, which is whether PharmDs are allowed to practice independently. So, without any further ado, let's get started and get answers for all these questions. So, guys, first of all, MBBS is a 5.5 year long undergraduate course against PharmD, which is a 6 year long professional post graduation course. Now, once you complete both these courses, you get to use doctor as the prefix. So, that is one similarity. Coming to what about the syllabus of PharmD and MBBS. So I would say the syllabus is nearly same when it comes to general medicine and clinical aspects. However, you do not get to learn about surgery in PharmD, which you really get hands-on experience when you are in MBBS. But PharmD equips you with the knowledge of various diseases, their treatments. You get to learn about medicines in way more detail against what an MBBS student would get to learn. Yeah. So you have these subjects, you have pathophysiology, you have pharmacotherapeutics, you have pharmacology, and you study them for like 2 to 3 years. So you can understand that you will get really deep knowledge about all these fields, right? And moreover, when you are doing PharmD, you get to learn about these drug therapies and you get to tailor them. You know, you have these subjects, pharmacokinetics and dynamics, that will equip you with the knowledge to, tailor these therapies according to the patient specific factors. So that can be really empowering, right? So apart from this, you really get to study chemicals in way more detail, and you even get to synthesize them. Like we in our first year synthesized liniments, lotions, solutions, syrups, elixirs, even suppositories. And we got to estimate various urine constituents. We did lots of chemical tests. We did assays, and we estimated the concentration of various constituents even in serum. So in your very first year, you're studying biochemistry, organic chemistry, inorganic chemistry. These are the subjects that you have already studied in 12th, and now in the first year you get a practical hands-on exposure to all these things, because I really see it from that point of view that whatever you have studied till your 12th doesn't go waste. You continue with that subject. Moreover, you really get to build on those topics, because these are the topics that will act as the foundational stones for your second year, third year, and fourth year. And guys, I would specifically want to highlight that PharmDs even learn about plants and the medicines that are extracted for them. Uh, an entire year, they learn about the subject of pharmacognosy and phytopharmaceuticals. So they have good knowledge about plant extracted drugs as well. So I could go on and on about these awesome subjects and lab experiences that you can get as a PharmD. It is really diverse, and trust me, it is quite interesting to pursue actually. At least for me, it has been a very rewarding and enriching experience, particularly because of the vast areas in which you get exposed to. So, all in all, MBBS is about learning surgery, anatomy, medicine, while in PharmD, you learn about medicines in way more detail. You learn about tailoring those treatments, you get to do drug related research, and much more. So, coming to the point of whether you are allowed to practice independently or not, well, it's quite disheartening that. Yet we have not been given that authority to open our clinics independently and practice independently. However, according to a notification by PCI in 2021, it is only the PharmDs who can be designated as clinical pharmacists, and they can be recruited into the hospitals. So it's not as bad, guys, honestly, because trust me, you can make a lot of difference in the hospital setting. You get to work with the doctors, and in that setting you can really use your knowledge, and you get to develop that trust in the healthcare team, and you also get a lot of exposure, and they also get to know your value. So it's really a good opportunity to be even working in the hospital settings. So I really hope that this video could add value to your knowledge base, and I am going to bring in the next video the list of books that a PharmD student must have, and I'm going to help you decide how you really go through and study these books, because there's a lot of information out there, but you have to cut it down to the bare minimum that has to be held by you, that has to be known by you, and how you can just maintain your notes and everything. So new content will be coming up soon. Till then, bye bye and namaste.